Hello, I'm Dr. Kearns, Head of Department for Emergency Medicine here at Blackpool Victoria Hospital. Before the pandemic, many patients would come to us just because they felt unwell. This was often not the best thing, as many would be waiting a long time to be seen by one of us and then sent to another healthcare facility. Although our COVID lockdown restrictions are constantly being modified, we still need to ensure people are socially distanced. As winter approaches, we expect more people to become unwell with their own chronic diseases. The need to keep people separated and away from other sick people is all the more real. To keep people safe, to cope with the increased demand, and to keep people away from the waiting room as much as possible, we have changed the way we do things here in the department. Before people come to the department, we want them to contact NHS 111 first, either by telephone or by going online. Remember though, if it is a life-threatening emergency, then they should still use 999. NHS 111 has taken on more staff to make sure you get to speak to a trained advisor far quicker than before. When you speak to an advisor, they will decide whether you actually need to come to the hospital or could be seen by another health service. If they think you should come to the emergency department, then you'll be given a booking to come. This may be straight away or after just a short wait. When you arrive for your appointment, you will register, give your name and tell us you have been sent by 111, and they will ask you to take a seat in the waiting area. The clinicians will then come and find you and take you to our dedicated 111 suite within 30 minutes of your arrival. With your help and cooperation, we will keep you safe. Make sure you are seen at the right place, at the right time, by the right healthcare professional. It's never been more important to keep the emergency department for life-threatening and emergency conditions only. Please use NHS 111 first. Thank you.